Hi everybody, Diva Star here, and today I'm going to be talking through you about urinary tract infection. You know, it's also called a UTI. Here's the overview. Okay. A urinary tract infection, also known as a UTI, is an infection in any part of your urinary system, your kidneys, ureters, bladder, and urethra. Most infections involve the lower urinary tract, the bladder, and the urethra. Women are at a greater risk of developing a UTI than are men. Infection limited to your bladder can be painful and annoying. However, serious consequences can occur if a UTI spreads to your kidneys. Doctors typically treat urinary tract infections with antibiotics, but you can take steps to reduce your chances of getting a UTI in the first place. Here's the female urinary system, and this is the male urinary system. Here is the female, here's the male. Okay, symptoms. Urinary tract infections don't always cause signs and symptoms, but when they do, they may include a strong, persistent urge to urinate, a burning sensation when urinating, passing small, frequent amounts of urine, urine that appears cloudy, urine that appears red, bright pink, or cola-colored, a sign of blood in the urine, strong-smelling urine, pelvic pain in women, especially in the center of the pelvis and around the area of the pubic bone. UTIs may be overlooked or mistaken for other conditions in older adults. Each type of UTI may result in more specific signs and symptoms depending on which part of your urinary tract is infected. Here are some of them. The kidneys, also known as acute pyelonephritis, signs and symptoms include back pain or side pain, high fever, shaking and chills, nausea, vomiting. In the bladder, it's pelvic pressure, lower abdomen discomfort, frequent painful urination, or blood in urine. The urethra being infected shows that you are burning with urination or vaginal discharge. Okay, here's when you need to see a doctor. You have to contact your doctor if you have signs and symptoms of a UTI. Here are some causes. Urinary tract infections typically occur when bacteria enter the urinary tract through the urethra and begin to multiply in the bladder. Although the urinary system is designed to keep out such microscopic invaders, these defenses sometimes fail. When that happens, bacteria may take hold and grow into a full-blown infection in the urinary tract. The most common UTIs occur mainly in women and affect the bladder and urethra. Infection of the bladder. This type of UTI is usually caused by E. coli, a type of bacteria commonly found in the gastrointestinal tract. However, sometimes other bacteria are responsible. Sexual intercourse may lead to cystitis, but you don't have to be sexually active to develop it. All women are at risk for cystitis because of their anatomy, specifically the short distance from the urethra to the anus and the urethral opening to the bladder. Infection of the urethra. This type of UTI can occur when GI bacteria spread from the anus to the urethra. Although Also, because the female urethra is so close to the vagina, sexually transmitted infections such as herpes, gonorrhea, chlamydia, and mycoplasma can cause urethritis. Here are the risk factors. Urinary tract infections are more common in women, and many women experience more than one infection during their lifetimes. Risk factors specific to women for UTIs include the female anatomy. A woman has a shorter urethra than a man does, which shortens the distance that bacteria must travel to reach the bladder. Sexual activity. Sexually active women tend to have more UTIs than do women who aren't sexually active. Having a new sexual partner also increases your risk. Certain types of birth control. Women who use diaphragms for birth control may be at a higher risk, as well as women who use spermicidal agents. Menopause. After menopause, a decline in circulating estrogen causes changes in the urinary tract that make you more vulnerable to infection. Here are some other risk factors for UTIs. Urinary tract abnormalities. Babies born with urinary tract abnormalities don't allow urine to leave the body normally or cause urine to back up in the urethra, have an increased risk of UTIs. Blockages in the urinary tract. Kidney stones or an enlarged prostate can trap urine in the bladder and increase the risk of UTIs. A suppressed immune system. Diabetes and other diseases that impair the immune system, the body's defense against germs, can increase the risk of UTIs. Catheter use. People who can't urinate on their own and use a tube catheter to urinate have an increased risk of UTIs. This may include people who are hospitalized, people with neurological problems that make it difficult to control their ability to urinate, and people who are paralyzed. Being paralyzed means you can't move a certain part of your body. Another one is a recent urinary procedure. Urinary surgery or an exam of your urinary tract that involves medical instruments can both increase your risk of developing a urinary tract infection. Complications. When treated promptly and properly, lower urinary tract infections rarely lead to complications. But if left untreated, a urinary tract infection can have some serious consequences. Complications of a UTI may include recurrent infections, especially in women who experience 2 or more UTIs in a 6-month period or 4 or more within a year. Permanent kidney damage from an acute or chronic kidney infection due to an untreated UTI. Increased risk in pregnant women of delivering low birth weight or premature infants. Urethral narrowing stricture in men from recurrent urethritis previously seen in gonococcal-urethritis. Sepsis, a potentially life-threatening complication of an infection, especially if the infection works its way up to your urinary tract to your kidneys. Prevention. You can take these steps to reduce your risk of urinary tract infections. Drink plenty of liquids, especially water. Drinking water helps dilute your urine and ensures that you'll urinate more frequently, allowing bacteria to be flushed from your urinary tract before an infection can begin. Drinking cranberry juice. Although studies are not conclusive that cranberry juice prevents UTIs, it is likely not harmful. Wiping from front to back. Doing so after urinating and after a bowel movement helps prevent bacteria in the anal region from spreading to the vagina and urethra. Empty your bladder soon after intercourse. Also, drink a glass full of water to help flush bacteria. Avoid potentially irritating feminine products. Using deodorant sprays or other feminine products such as douches and powders in the genital area can irritate the urethra. Change your birth control method. Diaphragms or unlubricated or spermicide-treated condoms can all contribute to bacterial growth. I hope you've enjoyed learning about the urinary tract infection, aka a UTI, like in short form. So thank you for watching and please subscribe to my YouTube channel. Bye!